So you may have come from your doctor and you've been told that your liver numbers are inflamed or you have liver inflammation. You may be wondering exactly what that is and what that can lead to. Well, in today's video, I'm going to give you the top 5 reasons of why your liver is inflamed, why your liver numbers are high. If you wait till the very end of the video, I'll talk to you about what we do as physicians to help work that out. Let's begin. So for those guys who are joining me, my name is Dr. Samir Islam, and yes, I am your poop guru. I want to think of me as your poop doctor. My passion is to give you tips and tricks to help out with your gut health. If you're new to these video series, I do a lot of videos on gut health, GI education, medical education, and educational videos just like this. At any point in time during the video, click on the show notes down below. I'll give you my recommendations about some of the things I'm going to talk about today. But in today's video, I'm going to tell you the top 5 reasons why your liver is inflamed. So having an inflamed liver is a very common problem to have, or having an elevation of your liver enzymes is a very common condition to have. A lot of people have this, and the difficulty thing about this is that a lot of people don't realize that their liver is inflamed unless they actually get blood work to see exactly what's going on. And there are a number of reasons why your liver can be inflamed. Now, a common reason that people can have liver inflammation is due to a virus, and there are a lot of viruses that can cause inflammation of the liver. Some of the routine viruses, including viruses that cause mono or herpes, can cause inflammation of the liver in some patients. But the most common reason, the most common virus to cause inflammation of the liver is hepatitis. Now, hepatitis can come in many different fashions, and there are many different types of hepatitis. But the most common hepatitis in the United States is hepatitis C, which is a viral infection that actually attacks the liver, causes inflammation to occur, and the inflammation can be over a long period of time. Now, the problem when it comes to hepatitis C is that a lot of people don't even realize that they have hepatitis C until they get to what's called cirrhosis, where you have end-stage liver disease. Now, because of the fact that hepatitis C is common, a lot of people don't realize it. We typically do screening for the baby boomer generation for anybody within that generation to get screened for hepatitis C. That's done with a very simple blood test. But having a virus infection is a very common reason why your liver enzymes can be inflamed. The second common reason why you have inflammation in the liver is actually medications. There are medications that people take, whether it's medications for arthritis, maybe it's autoimmune medications, or even medications like lipids or statins or cholesterol-lowering medications that can actually cause inflammation of your liver. And so if you have inflammation of your liver, you actually may be on a medication that can very commonly cause it. And one of the best ways to help stop that or prevent that is to stop the medication and check your liver enzymes about 3 to 6 months after you've stopped the medication to see if they have improved or not. Now, there is a fine balance between having to be on a medication for the benefits and maybe some of the risks, including causing inflammation of your liver. So make sure that you speak to your healthcare provider before you stop any medications. Don't stop it on your own. Make sure you speak to somebody about whether you can stop it or whether you should stop it. The third most common reason why you can have inflammation of the liver is either an autoimmune problem in the liver or maybe even a genetic problem within the liver. There are a lot of autoimmune conditions that occur within the liver that can cause inflammation, scarring, and a lot of irritation inside the liver. Some of those things include PBC, or primary biliary cholangitis, PSC, primary sclerosing cholangitis, or even autoimmune hepatitis. These are all autoimmune conditions that can cause inflammation in the liver. There are also some genetic abnormalities, including hemochromatosis, which is an abnormal absorption of iron into the liver, or even Wilson's disease, which is the disease that affects typically younger individuals due to a copper problem. These are also autoimmune and genetic problems that can cause inflammation of the liver. The fourth most common reason why you can have inflammation of the liver is alcohol. Now, alcohol has a lot of bad side effects within the GI tract, including causing irritation of your stomach, diarrhea, maybe even esophagitis. But in some people, alcohol can be a very damaging product for your liver. It can cause inflammation and it can cause end-stage liver disease. And so if you drink alcohol and you have inflammation of your liver, one of the best things you can do is to actually stop alcohol, completely eliminate it. I can tell you, not only will you feel better, but your liver will thank you as well. And the fifth and the most important reason why you can have inflammation of the liver is actually fat. Fatty liver disease or non-alcoholic steatohepatitis is probably the most common reason why people have inflammation of the liver, and also the most common reason why people can get liver cirrhosis or end-stage liver disease. Now, a lot of people don't realize that they have fat in the liver, and the problem with fatty liver disease is that it doesn't cause symptoms until it's way too late. But you actually may be at risk for that, especially if you have diabetes, hypertension, you're overweight, you don't exercise. These are all risk factors for developing fatty liver disease. And this is the most common reason why people can develop inflammation of the liver and have liver irritation. Now that we talked about the 5 most common reasons why people have liver inflammation, what do we do as a GI doctor or as a physician to help figure out exactly what is the cause and what is going on? There are 2 main things that we do. One is that we get a whole bunch of blood tests. I'm like a vampire. I take vials and vials of blood, and these blood tests allow me to determine the stage of your liver problem, the cause of your liver problem, how bad is it, and what we can do to make sure it doesn't get any worse. And these blood tests help us to categorize exactly why you're having the inflammation and what's going on. The second thing we want to do is imaging of the liver. Now, there are a lot of different ways that we can image the liver. We can use an ultrasound machine, we can use an MRI, we can even use a CAT scan, or some other dedicated liver imaging test. But we want to get some way to see how the liver looks, make sure there's no obvious masses, make sure there's no obvious enlargement or shrinkage of the liver, or even scarring of the liver as well. But by doing blood testing and getting imaging, we can usually find out the vast majority of the causes of why your liver is inflamed. I want to thank you guys for joining me today. My question for you guys is, what questions do you have about your liver disease? Comment down below. I'd love to hear what you guys have to say or what questions you may have. I'm going to thank you for watching. Don't forget to hit the like button. I look forward to seeing you guys at more videos. Thanks and take care. At any point in time, and people can have a virus like hepatitis C, but these are tests, and these liver